Going through the interview assignment rubric, I feel like I did a pretty good job with my medical history interview with one of my patients. For professionalism, I would give myself between a 3 and a 4. Um, I feel like in the beginning I was a little nervous and got a little tongue-tied, and I wasn't as comfortable asking certain questions just because I didn't feel confident. But as the um, interview went on, I felt a little more comfortable. I felt like I knew a little bit more of what I was talking about. For example, my patient started to talk about the fact that she had anemia about 15 years ago, was diagnosed with anemia, and we talked about how she is able to monitor that, or what she does if she feels the symptoms of that coming on. So we were able to kind of dig a little bit deeper. So I feel like towards the end, I got a little bit more comfortable. In the beginning, I was definitely a little bit more nervous. As far as individualized care in questioning, I gave myself a 5. I do feel like I was effective in communicating with my patient. I was able to ask questions that were geared towards her specific medical history. For example, the anemia. She has an apricot allergy, so I was able to ask a little bit more about that, what her symptoms are, what triggered, or if it's triggered just by the ingestion of it or um, by touching it. So with that, and she does get dizzy sometimes due to dehydration, but also can be due to the anemia and an iron deficiency. So being able to ask those questions, I really got to understand things that she might need a little bit more. And then mastery of the subject, I gave myself a 5 on that as well. I knew that because her anemia hadn't affected her in the last 10 to 15 years, that we wouldn't really need any lab work or anything like that, and it shouldn't inhibit any dental treatment that we would be doing that day. And same thing with the dehydration, the dizziness and things that she feels with that. We just made sure that she's properly hydrated for the day. We were able to take a couple breaks so she can get some water, and I made sure to lower the seat slowly, lay her back slowly, definitely gave her some time and let her know when I was going to be moving the chair, just so that she had an awareness of it and it didn't come as a shock, and we were able to kind of monitor that. And I feel like I could improve on being a little bit more confident in my knowledge overall, because we are still in the med comp class. I feel like I haven't mastered all of the different medical things that can hinder a patient and how they would affect them, which I don't think anyone's expecting us to be fluent in all of that. However, I do feel like I could do a better job at preparing a little bit before my patient comes in, maybe the day before or so, and just making sure I know exactly what medications they're taking and how they can impact dental treatment. Being a little bit more prepared would probably be beneficial in the future. I do feel like I handled this interview very well, though, and it was a last-minute patient for me. I got her in my schedule the afternoon before. It was on a Wednesday, I believe. So Tuesday afternoon, I was able to get her scheduled for Wednesday morning. So I didn't have a whole lot of time to dig super deep into her medical history or anything like that, but it wasn't anything too extensive, and we did have a good conversation between the two of us throughout the beginning of her appointment, so there was a lot of understanding, and I knew what she would possibly need, and she understood what we were going to be doing as far as her treatment goes. So I think overall it went well.